In today's video, we are going over rehab exercises for a sports hernia. Before we get into those exercises, I just want to explain what a sports hernia is. It's a strain or a disruption of the tissue of the abdominal wall where it attaches down at the pubic bone. And also part of it is the inner thigh muscle called the adductor. Where they meet, there is a disruption, a tug-of-war that happens there. So in some of our rehab exercises, we're going to go over working on pelvic stability for this injury and start to use the abdominal wall and the hip flexors in a different way as to not disrupt or re-injure this area. Okay, so in this first exercise, we're going to be working on, again, pelvic stability as we load into the hip flexor. This is the first one of 3 exercises that we're going to go through. My favorite one's going to be taught in the end, so please stick around for that. So after about a few weeks of rest, this is where we start to introduce some rehab in. You've probably seen this exercise before, but one critical piece that I see is missing in the way that it's taught or the way that it's done at home is actually the proper way to build a stable base. So we're going to pause on this part to begin with, and we're going to work on how to properly breathe and brace into the belly here, okay? So go ahead and stick those ribs up again for me here. This is the first thing we want to see if we can start to get rid of. We're not going to push down into the floor, but we're just going to tuck them away into our front pockets here. And then at home, you can take your thumbs into your sides right there above the hip bone and breathe deep into the belly. Push the fingers away. This is a critical part to building the leg movement and the hip flexor into the exercise. So we're going to breathe in, push the fingers away, slowly pull the knee towards the chest, hold. Make sure we still have that brace, and then slowly lower it down without losing it. And we'll do that again. Big, deep breath in, push the fingers away, hold. Slowly lower down without losing that brace. So all of these exercises are going to be done for about 2 to 3 sets, 6 to 8 reps, and should not create any pain. If there is pain, you need to regress to the one before, okay? This one is a progression of the first exercise. I'm going to have you hold on to the ball here, okay? We're going to flatten our legs, and we're going to start by using that intra-abdominal breathing. So big old brace into the belly, lift the leg in a straight fashion, touch the ball, hold. Good, maybe even push the ball into the hands a little bit or into the foot a little bit there, and then slowly return. Again, if this one's creating pain or it's too hard for you, go back, try exercise number 1. Make sure that one, it has a solid foundation first before we move on to this one here. Big brace into the belly, touch the ball, pressure, and slowly control down. For this last exercise, this is going to be the first introduction into reusing the inner thigh muscle, the adductor. So we're going to take something like a foam roll or a small kind of squishy ball at home, something that has a little bit of a give to it, and we're going to put it into the knees here, okay? This is the favorite exercise I was talking about, so I'm going to show you some progressions of this one, okay? As always, stable base first, so we breathe and we brace into the sides there. And only about 30% of your effort are you going to squeeze that yoga block in between your knees for about 5 seconds. 4, continue to breathe. 2, 1, and take a break. And you can repeat that for sets and reps. See how the body tolerates that first before we progress into the next one, which again is a breathe, a brace, squeeze only 30%, nothing too crazy. Start to lift the bum off the ground. Hold there. We want to make sure we're not hyperextending at the low back here. Okay, so that's why that intra-abdominal breathing is super important. And then we're going to control that back down. Okay, the last progression of this one is actually going to be turn this into a single leg. So keep that squeeze, but take 1 foot away. Okay, holding, breathing, making sure we're not rotating at the pelvis. Again, we talked about the importance of a stable base before we go through some limb loading here. Typically, this exercise can be a little triggering for some people because we are using that injured tissue. If you want to know why it's painful or if it is right for you, there's a link in the description below for a sports hernia recovery plan. Go ahead and take advantage of that. If you want to talk to us or ask some questions, you can also reach out. We can do virtual or in person with you.